Welcome, everybody, to the Kona Shane Veterinary Podcast. I am your host, Dr. Andy Roark. Guys, I got a fun one for you today. I am here with Julia Sosa. She's the Chief Experience Officer at Pumpkin, and she is talking about access to care when the case is critical. You know, I talk a lot about making sure that pet owners are able to afford care, and I've had some experience. I've actually been writing a lot recently about sort of concerns that I have about just generally the rising cost of everything, but especially pet insurance. And when we emphasize that pets are part of the family and we continue to have prices going up and up, I worry about how that interacts when we start to not be able to afford things. And this language around fur babies and pet parents and things. And I think there's pain there. I'm looking at that and I'm kind of thinking about that. And I would like to avoid those types of collisions down the road. This episode today is all about making care accessible when we have a critical situation on our hands. And we talk about how that workflow is different from less urgent cases. We talk about what some options are for pet owners getting support, and honestly, how to get those appointments done and provide the best experience possible to the pet owners at the same time. Anyway, this episode is made possible by Pumpkin Pet Insurance. Guys, did you know that Pumpkin has a new service called Pumpkin Now? It's really unique. It's an urgent pay service that just launched about 8 weeks ago, and they have already expedited payments for over $3 million in claims in just those first 8 weeks. Pumpkin Now, as it's called, is designed to support the visit experience so pet owners know what's covered and they can get paid for eligible critical expenses in minutes before they even pay the vet, guys. It's getting a lot of buzz, and it is something that helps pet owners afford the care that they need. So pets are getting better care, owners are feeling more supported, and vets are getting to deliver the services that they desperately want to deliver. Guys, if you want to learn more, check out Pumpkin Now. I've got links in the show notes. Let's get into this episode.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast, Julia Sosa. Thank you for being here.
Thank you so much for having me. It is an honor.
Well, it is a pleasure to have you here. For those who don't know you, you are the Chief Experience Officer at Pumpkin Pet Insurance. You do a little bit of writing yourself. You mostly write for pet parents, but I've seen some of the things that you've written come up. And you are interesting, and I wanted to talk to you a bit because, well, one, so I've been on this kick recently, really about looking at like access to care. You know, I'm looking at the rising cost of care for patients. I'm looking at how prices for pet owners increase. I'm looking at how visits are decreasing. And I'm looking at these larger trends. And I really want to continue this exploration of what are the tools on the table? And then what have we had? And I've kind of, you know, pet insurance has been around for a long time, but I don't think that it's ever been fully leveraged. And I'm really fascinated at what we can do better differently, and then also what the future kind of looks like. And so I wanted to talk to you. You are, you know, as the Chief Experience Officer, the way I was introduced to you was that you actually juggle two different quote unquote kind of clients. So you're focused on both the user experience that the pet owners have and then also the user experience that the vet clinics have. And you sort of expressed to me how wildly different the vet clinics are in their workflows and things like that. Can you talk at just sort of a high level about what that means when you say you look at the user experience for pet owners and for vet clinics?
Sure. And, you know, one of the kind of interesting things was that from, you know, before Pumpkin even launched, we were always very adamant about we wanted to be the most hospital-centric pet insurance that was out there. And so we made a very conscious kind of decision that in order to do that, we had to think about our customer, not just as the person buying the policy, but also the other players that are impacted by the customer having the policy. And that's primarily, I mean, of course, it's pet, but it's also the hospital staff. Right. And we think about the hospital user experience. Where do they go to find out information, get resources? How can they support conversations they might be having with their customers? And then how do we make sure that when we're interfacing directly with our pet owners, that when and where it's appropriate, we can also provide a very similar level of transparency to their veterinarian.
Okay.
So really thinking about it as anytime a pet is in need of care, there are two people at a minimum involved in it. Three if you count the pet, but there's the pet owner
Sure.
and the patient and then the veterinary staff. So we've always tried to have a user experience team that thought of their customers and approached user research and product design with a lens of both of those at the core.
So I really love the hospital. So as a veterinarian, I like the hospital-centric approach and design. What have been the things that you have learned, I guess, around being a hospital-centric approach? When you say that, I'm sure everybody's like, oh, sure, we're easy for vet clinics to sort of engage with. What has been sort of the main focal point of having a hospital-centric approach in your mind?
If you look at the trends in like more established pet insurance markets like the UK and some other countries in Europe, we know that the reason they were able to get to a place where a pretty high percentage of pets are insured there versus like the 3% in the States, the veterinary community played a tremendous role in just educating pet owners about cost of care, access to care, and pet insurance being one thing. Yeah. So we always believe that the veterinarians would play a very critical role in helping pet owners see the value of insurance. Well, you can't expect veterinarians to believe in the value of pet insurance if you're not providing, and of your insurance, if you're not providing an exceptional experience to their hospital and their staff.
Yeah.
So that's just kind of like the background on that. And then I think the things that have been the most kind of, and they probably won't be revelations to like most of your audience, but to, someone like myself who coming into this field had never worked in a veterinary hospital. The things that really struck me, and I think have really shaped a lot of the decisions and the priorities in terms of what we build and what we launch, are most vets don't want to talk about money.
Yeah.
And that's, again, so obvious, but in the early days of Pumpkin, it was hard to help, maybe an insured pets drive more revenue. Okay, but maybe a practice owner really, really it cares about that and is focused on it, but not your veterinary technicians aren't.
Right.
And it's part of the whole team. So understanding that ultimately our mission is to enable access of care. Mm-hmm. And that aligns with what most, not speaking for them, but most people in the veterinary profession intrinsically want to do, right? They're motivated by providing care, not necessarily the financial part of the care. So it was recognizing that money is not their love language, which I, of course, neither is mine. I'd give everything away for free if someone would let me. Recognizing that really changed the way we talked about what we needed to build and what vets would really value. Mm-hmm. The second piece would be, man, every single hospital does things different. It's really hard to find a lot of hospitals, and unless they're part of a very large corporate group. And even then, I would say it tends, in our experience, to be the exception, that when a corporate group has actually managed to streamline all the processes and workflows across multiple clinics. And so if you approach showing up for your hospital partners and designing user experiences for the masses, you're probably going to end up creating a solution or an experience that doesn't really work for anyone well.
Yeah.
Or only works for a very small slice of them. And so trying to think really less about big blanket solutions and more very like small, simple ways that you can show up and solve a problem without forcing learning new tools, forcing them to change the way that they like to do client or patient intake. Those would be probably two of the biggest ones.
Yeah.
Yeah.
Looking at sort of the flexibility that you're sort of talking about building and the variation between clinics, what I thought was really interesting when you and I started talking is Pumpkin over the last year and a half has really been focused on almost like I don't want to say urgent care because people have ideas about what that means, but on emergent care, right? It's very much about, it's been an interesting focus on what does access to care look like specifically when care can't wait. This is not a discussion. This is not a puppy conversation, like let's talk about pet insurance, but it's very much there's an urgent medical need. This person is in the clinic. They're having an emotional experience. Every clinic is different, and we want to be supportive. Start to unpack for me a little bit what Pumpkin now is and kind of what that focus was and kind of where it came from.
it's been really, really exciting and humbling journey to get here. It's really been about 2 years in the making. We started by launching a series. It was 2 different pilots that we ran with somewhere between 50 and 75 hospitals over the course of 2023 and 2024.
Okay.
To understand basically just how we can best support them in different care scenarios.
Okay.
And at the same time, we were doing a lot of analysis of our claims, our customer reviews, our hospital feedback. And what we started to identify was that it makes up a relatively small amount of, in Pumpkin's world, claims, but that equates to care situations,
Yeah,
right?
those are cases. Yeah.
Yeah, they're cases
Yeah.
that exceed $1,000. But it makes up way over half of what we pay out every year.
Gotcha.
Those are also maybe the most complicated cases. They're the ones where, man, there might be multiple treatment options that a hospital could recommend. They're the ones where if it's over $1,000, $5,000, that you might have a client really having to make trade-offs.
Yeah.
Or make a decision on how conservative or aggressive they feel comfortable proceeding with the treatment plan. But it was also where there was just the most emotion, stress, and sense of anxiety and uncertainty on both the pet owner and the hospital staff.
Oh, wow. Okay.
And we'd hear a lot of times like the fear from clinics of, in those moments, I want to do everything I can to help. And at the same time, I don't want to be caught in the middle in that situation of trying to navigate a bunch of noise or paperwork or claims or anything like that.
Yeah.
And so for us, what was kind of interesting is that we took a counterintuitive approach that said, we're going to lean in to the 10 to 15% of claims that are the real nail biters and gnarly ones. And they're the moments that even for people with insurance, that anxiety of, God, are they going to pay me back? Or is this definitely covered? Especially if it's the first time. Is just not. It's been in your stomach. We've all experienced it. I sometimes equate it to like filing my expense reports. And there's always still like a moment where I'm like, will I really get the money back?
Yeah.
If we could solve that, that's the harder piece to solve, but it has the most impact on how people experience those really, really defining moments in pet ownership.
Well, it's really the 80-20 rule, right? Like it's really that focus on the 20% of cases that create sort of 80% of the impact. And we say, yeah, numerically, this is a small number of cases or a small number of claims, but the impact is really outsized, both financially and emotionally. And so that makes a ton of sense to me. I like the perspective, and I think that's a good approach. So start to talk to me about that. So what does this look like? You say, you obviously set out with lofty goals. You're like, these are stressful situations. Time is of the essence. People are trying to make decisions. They don't know what resources they have. It's kind of the nightmare situation that we see all the time in cases or in clinics is, being a good veterinarian is not just knowing what the right answer is. It's generally navigating with limited resources and not really great options and being okay with that and keeping your team on board with it. And so I can see having this sort of access to this type of clarity being really, really helpful. So when that started to come together in practice, Julia, start to lay down for me sort of what Pumpkin now looks like in terms of what are the pieces, the components, what does that actually look like when we see it and we've got an urgent case, we're trying to decide, can we go to surgery? This dog's got a septic abdomen. Are we doing this? Are we not doing it? What does that look like for my team?
It's another kind of great example of, we said, based on our learnings, we can't just build this urgent pay service for hospitals to use because too many hospitals just don't have any of the resources. By resources, I mean staff mostly, or time to sometimes even in these critical kind of moments, log into something, submit a claim, get on the phone. I mean, a lot of them will, especially in these moments.
Sure, but it's hard.
It's hard.
Yeah.
And so our goal has always been to minimize as much of the work that has to be on the hospital, even in these moments. And so anything we build, it should be able to be done by the pet owner too.
Okay.
At the vet, when they get an estimate, when they're scheduling a surgery, they can submit all of the information themselves. They can submit the either the treatment plan, if they're trying to get an estimate approved, or the invoice, if it's for immediate kind of care or claim.
Yeah.
And we will automatically triage those requests to determine, are these requests that meet our current criteria for critical care, which is arbitrary a little bit. It's $1,000 plus for claims, or meaning for treatment that is immediately going to be provided or has been provided, or estimates of any amount. But basically, if a hospital doesn't even know pumpkin exists, but one of their clients has pumpkin, then their client, when they are in that hospital, find out that Lenny needs most likely this kind of treatment very soon, whether it's that day or this week, the client can go into their member center and they can submit a request and will be notified if it's eligible for pumpkin now. If it is, we communicate the outcome to both them and their veterinarian, even if the veterinarian didn't do anything, just so everyone's in the loop. And then they will get confirmation of a decision like, yep, this estimate's good to go. If it's a range, we can tell them the range it would be approved. If it's a claim, we can break down for them. Yep, maybe they haven't met their deductible, all that kind of stuff. But we can give them that clarity. And if it is a claim, like a case where they've moved forward with the treatment, we can make a real-time payment to the pet owner that they can then use to pay the vet bill. And I think a lot of that value, it is having the money at hand and removing that like friction and uncertainty of being out of pocket even for a couple of days. But I think it's especially around like it's such an emotional thing when you're trying to navigate these bigger, more, costly care scenarios. So a pet owner could do everything without ever needing to really involve the staff or distract them from the patient.
Yeah, so I have questions. So first of all, that to me is really cool. I like that. I like that a lot. The idea that this, because we're talking about we've got a crisis, we've got something that's going on. We're trying to get care of the pet. The idea that I could delegate you go figure out you figure out what resources you have. I can give that to the pet owner and not make my team do it. That's great. So I like that. So questions I have is, so here we are. We've got this pet. They've got a septic abdomen. We don't know why. We're trying to figure it out, and that's going on. When they log into the member center, is there a checkbox for this is urgent? Do they request something urgent? Do they just put in a claim and it's going to be picked up by the pumpkin team as, hey, this looks urgent? Like, what is that sending up the flare look like?
So it was very important to us that it wasn't a completely separate standalone process.
Yeah.
That the pet owner, we had to educate them on, or the hospital. It's enough work just for people to know how to file a regular claim.
Yeah, sure.
And so instead of building something separate, we basically incorporated it into our existing user experience in the exact same way. And yes, there are questions in the form. I mean, this is super, it takes a minute, if that, to fill out.
Okay.
But when we know the amount, to give you an example, if it were a claim and it's $300, we're automatically going to boot it out of the Pumpkin Now queue and communicate to the pet owner why that is. And if there's an issue, then we can see what we can do. Okay. But that's all to make sure we prioritize care for the pets.
Of course.
Most needed.
I'm really fascinated. If there was a big button that says, this is urgent, how many people would just push it? You know what I mean?
That's the problem.
I mean, 100%. It just seems like when my baby has diarrhea, it's like we're hitting the urgent button. Yes. And so, I can just see that mentality. That's why I'm really sort of curious in what that looks like to the owners.
That was one of the big learnings in some of the prerequisite pilots, right?
Yes, that makes sense.
It's not just pet owners.
Sure. Oh, 100%. No, I tell you, when my dog is sick, I lose my whole vet brain. It just completely goes out. I need a grown up in the room when it's my boy.
Yeah.
It makes sense.
Yeah, I think you learn very quickly, and I love it. This is why we do what we do.
Well,
people are gonna self-select in.
Yeah.
But also, a really important kind of user experience principle is put as little of the effort and decision making on the user if you don't need to. So instead of making you factor in the criteria and hoping you follow that criteria and say like, oh, it's actually not urgent. Instead, we built it into the request flow, and they basically get kind of interstitial messages that say this may be eligible for Pumpkin now. So it's over $1,000. It's within the service hours. We're not yet 24/7. We're hoping to be soon enough. That's very important to us.
Sure.
But we can let them know that if there's anything that they need to be aware of, like, okay, we're on it, but we're not going to be able to do it in 15 minutes because we've got to actually go through your medical records for the very first time. Then that becomes a personal communication from our team that also goes to both of them. But so it's kind of built so that they're not making that decision, that we're more able to guide them towards the likelihood that we'll be able to deliver on our goal of 15 minutes.
Sure.
And if we're not, then we communicate that. And of course we have bat phone options too. If it's someone that really is in a situation or a pickle and there's extenuating circumstances, we're always going to do whatever we can.
Yeah. What information do they put in here? I thought this was interesting where it was like, all right, you have the estimate in hand. We're trying to make the decision of what we're going to do, trying to figure out what resources we have. They're in their member center. They're like, yep, this is what it is. It's over $1,000. This is where I am. This is the vet clinic, things like that. Are they just keying in like, this is the total amount and just sort of typing it in? Do I need to provide them with a printed estimate that they can take a picture of and put that in? Just real quick, like how does that piece work so that Pumpkin gets the information, goes, all right, we're going to engage with this or not?
Yeah, so great question. Again, we have built some guided content into the request flow so they know kind of what to ask for, because sometimes even a pet owner might not ever even think to ask for an estimate or treatment plan, right? So we kind of inform them, but basically they fill out the bare minimum information, date of visit, pet, the estimated cost, and it can be a range if it's an estimate, which many of them are. They are instructed to upload the estimate or treatment plan, and we guide them on like what to ask the vet for. They can just take a picture with their phone and upload it. The vet doesn't have to send it to us themselves. Like the pet owner can just say, can I get this estimate so I can upload it? They'll upload that estimate. It's not always that we need medical records, but it can happen. And it does happen, especially for like these bigger, more extensive things. And it's like a pet that's only been insured with us for a few months. So what we also did in kind of parallel to the launch of Pumpkin Now was we revamped our customer onboarding experience so that when they're signing up, we're proactively requesting their medical records from their veterinary hospitals.
Gotcha.
So that we have a much higher chance of having the records on file if and when they have one of these critical care scenarios.
Yeah.
It's still, if their medical history is 30 pages long and we've never looked at it, that's going to be one of those where we're on it, but it might take us 20 minutes or 25 minutes. So, but we really work to get as much information right when the pet owner enrolls. And then, hopefully then in these critical moments, you're not having to chase people down for quite as much.
That totally makes sense. Julia, this is really exciting. I love the idea. I love the 15-minute window to try to turn things around. I love this clarity, especially during urgent cases. And it's been fascinating to watch this come from an idea of the selection of what are we going to focus on. Where can people learn more about Pumpkin Now if they're thinking about for their pet owners or for their clinic, stuff like that?
You can visit pumpkin.care. So that's our website, www.pumpkin.care. You can learn, we'll have resources there. You'll see kind of where we walk through our process or what's it like to file a claims and estimate. And Pumpkin Now is talked about all over the place there and helping people understand that.
Awesome. Thank you so much for being here. Thanks for talking through this with me. Yeah, guys, thanks for tuning in, everybody. I hope you took something away from this. I think it's fascinating. I love to see where we're going. And like I said, I'm so optimistic about making sure that care stays accessible and affordable for our pet owners. And it's great to see innovation around the times that pet owners need it the most. So guys, thanks for tuning in. Take care of yourselves, everybody. We'll talk to you later.
Thank you so much. It was really fun to talk about this.
And that's what I got. Guys, I hope you enjoyed it. I hope you took something out of it. Thanks to Pumpkin for making this episode possible. Thanks to Julia for being here. Gang, a lot of food for thought here. Again, I am optimistic that the future is bright. I think that there's a lot of things we can do to help pet owners get access to care. It involves some planning. resourcing. It involves being intentional. It involves setting expectations and educating clients well ahead of the time, and doing everything that we can to try to minimize the number of cases where resources are really a terribly limiting factor. And again, I'm a perpetual optimist. I think this is something worth working on and striving towards and continuing to innovate towards. So anyway, that's it from me, guys. Take care of yourselves, everybody. Talk to you later.